Turcotte. I'm an orthopedic surgeon at the MUHC. I've been there for the last 21 years. Prior, I was at Maisonneuve-Rosemont Hospital. So my career was based on orthopedic oncology, which is the surgery of bone and soft tissue cancer and benign tumors. So I've been, let's say my work was mostly clinical. I was involved in clinical research and so on, but I did over time understood the need for basic science in my field and was able to recruit 2 full-time scientists working on sarcoma research, which is the type of cancer we're dealing with, and also recruit faculty with many more qualifications than myself. People who have a background in engineering, people who are PhD in AI. So that's been the scope of my career. And lately, I've been also involved. I introduced Osseointegration for amputees, which is basically inserting a rod in their amputated bone to obviate the need of a socket for wearing a prosthesis, which improves tremendously quality of life and the level of activities of the lower limb amputee.
How does a focus on surgical oncology prepare students to tackle some of the biggest challenges in cancer treatment today?
Well, as you may know, cancer is a very prevalent disease. Incidence is increasing, especially for some cancer. Even the age of occurrence of cancer is becoming younger for unknown reasons in recent years. Cancer it has been also a very interesting evolving field over the last 20 years, not only with the introduction of new therapeutic modalities such as immunotherapy, CAR T-cell and so on, but also because of the refinement and the use of technology to make surgery more precise, less invasive, and creating less function impairment.
What opportunities do students have to work with cutting-edge technologies like robotics and image-guided surgery in the fight against cancer?
Absolutely. So this is where we're standing at the moment, having tools outside the OR to plan surgery. So now we have, MRI, CT scan. We can fuse these images and correlate them with the PET scan, which is more biological aspect or expression of the tumor, and tailor the area of the organ to be resected more precisely. So to include entirely the cancer and somewhat of a margin of safety around that, but also minimizing the deficit created. And we can use also technology to guide us during the surgery with this pre-op planning, having either cutting guides, for instance, made to develop or printed to make precise bone cuts. For an example, we can have robotic assisted surgery, so where a robot currently will guide your hand proceeding to bone cuts. But at the same time, we're working in-house to a new technology where the robot will be almost autonomous to perform the pre-planned procedure as such. Also augmented reality to see in the patient through the skin, for an instance, the bone, the tumor, and plan the incision and plan the muscle cut in respect to where the tumor is located, and not just relying on X-ray on the screen or a CT scan to try to interpret, if you wish, these images, which leads to some imprecision, to some margin of error. So the goal is to minimize error, maximize retention of normal tissue, and ensure complete resection of the tumor.
Can you describe the interdisciplinary nature of surgical oncology and how students can contribute to advancements in this field?
Well, surgical oncology, and I'll say specifically orthopedic oncology, has been an area where inter and multidisciplinarity are involved. You cannot be alone in your corner and provide for every care of a cancer patient. So you need a team of physicians that will include the radiologist, the nucleus, That may include other surgical specialty. I may create a defect in the limb, but I need plastic surgeons to drop a flap to cover the skin deficit. You might need to, if you were resecting a pelvis, you might need a general surgeon to perform a colostomy or to get some organ resected and blocked with the piece of tissue. Same wise, we do surgery, let's say the cervical spine in the neck with ENT surgeons who have more expertise than us, in this anatomical area. And then you get to all the people around, including radiologists, but pathologists for pathology interpretation, for intraoperative assessment of tissue biopsy that might be performed. And so these are all people we talk every day in the usual clinical, environment we work into. Plus, then, cancer, as you know, is a very disruptive disease, and people need counseling, people need support. So having psychologists, pulmonologists, all the people that rotates around the patient, that include the booking appointment clerk, So all these people are involved in the team in the cancer management. So surgical oncology is really a wide area that involves a lot of collaboration.
What impact can students make in improving cancer care through research and innovation in surgical oncology?
Well, research and innovation are the keystone of future of cancer management. So hopefully during their training, students and residents, and I include fellows later on, would get involved into clinical or research project that will either address a question, review the outcome of certain disease or certain form of treatment to be compared, or to work on innovative procedures or technology in order to better understand the deep nature of the tumor we deal with, and the very now unique signature of cancer bearing the same name. So we know that, among, let's say, breast cancer, there are many variants of breast cancer, and some are molecular. So now it's not only, having a cancer and having a standardized treatment. Now, oftentimes, it would depend on the gene expression of this tumor in the selection of proper medication or targeted therapies. And this is what we call personalized care of cancer patients.
Do you have a message for prospective students in your field of research of surgical oncology?
Well, yes. Being a cancer surgeon carries kind of two hats. Of course, you need to be skillful in your surgical technique. You need to be knowledgeable. You need to be a scientist. But you also need to be there for your patient. You need to be their advocate, with the bureaucracy, with the hurdles to the medical system. You also need to be available. So you're responsible for these patients. They do develop complications following surgery. They do have issues. And so I would recommend that in addition to the interest into surgery and into innovation, that people keep in their mind that part of being a doctor is to be available and dedicated to your patient.